Welcome to your instrumentarium Op30 training. We'll start with the on-off button, which is located on the back of the unit, 18 inches off the floor. You can leave this unit on indefinitely or turn it off as frequently as you wish. The exposure button is located on a coil cord on the back of the unit, or it can be wall mounted. There's a control panel on the front of the unit. The controls located here are the reset button, which will reset the pan to the home position, ready for the next patient after your pan. The up and down arrows, which move the unit up and down. This unit positions off 3 laser lines, a mid-sagittal line, which will be right down the center of the patient's face, a Frankfurt horizontal line, and a canine light. Those lights turn off after 30 seconds. If you touch any button, it will extend it 30 seconds, or the light bulb will go ahead and just turn it right back on for you. The blue tab to the left of the mirror adjusts that Frankfurt plane light. You have the Nasion support, which pushes in freely, or press the black button and it slides out freely. Moves up and down freely, both directions. The temple supports can be moved from this black knob, or at the top of the support. You do not want to move them at the bottom. You want to make sure that the Nasion is all the way forward and the temple supports are all the way open before you put somebody's head in. The canine light is controlled by this black dial just in front of the chin rest, using the graded scale and the black line on the unit. The touch screen, located on the side of the unit. P1 is adult pan, P2 is pedo pan. General rule of thumb is 7 years old, 70 pounds and under. A bilateral TMJ, joints only, and an extra oral bite wing. You can adjust KV based on patient size. If you have a patient that is very anxious about having a pan taken, you can touch the T button and you'll notice all these numbers turn off. There's now no radiation. You can show a patient the function of the unit. Once they're comfortable with it, touch T again and all of our numbers come back. At this point we could activate our software and you would see a green ready light, just like this. On the bottom of the touch screen, we position our patient and take our pan. You have 2 different bite sticks with the unit. You have your standard bite sticks. Teeth go into the grooves. And you have your edentulous or partially edentulous bite stick. It can be used this direction or this direction. It does have a 5mm ball bearing implanted in it. You can use that for your calibration purposes. When you put the bite stick into the chin rest, you will grab a bite stick barrier, twist it, and slide it directly onto the bite stick. At this point, when you have a patient ready to enter into the machine, you want to make sure you set the chin rest high enough that they can't put their chin on it. Patients like to lead with their chin. We want to take that choice away from them and make the handles visible. We'll ask the patient to grab the handles. We are going to put our left foot out in front of the patient just below the bottom of the handle. Ask the patient to step up to it. They have something physical and visual to step up to. At that point, we can set the chin rest at the crease in the chin. We are going to ask the patient to lift their chin, pull into the unit, and close lightly on the bite stick. We'll make sure that the center line is centered on the upper lip. If it's not, ask the patient if they see that line down the center of their face and ask them to center it on their upper lip. Do not use the nose. Next, we want to get this red light to the bottom of the eye socket. That's accomplished with the blue tab to the left of the mirror. Now that that's on the bottom of the eye socket, we need to get it on to the tab in the ear called the Tragus. We'll use the down arrow, hold the back of the patient's head, and ask him to tuck his chin as we lower the unit. At this point, we are on the bottom of the eye socket and the tab in the ear. We'll ask the patient to smile so that we can see if the canine light is on the maxillary canine. If it is not, you would simply use this black dial to adjust that forward or backward. Once the patient is done being positioned, we will place the Nasion support and close the temple supports. Ask the patient to close their lips. Grab your exposure button. I'm putting it in test so that you can see the function of it. We'll ask the patient to swallow and hold their tongue to the roof of their mouth. As soon as the machine stops, we let go of the exposure button, open your temple supports, ask the patient to step out, and go ahead and press the reset button so that the machine's ready for the next patient. This concludes your training on the OP30. We hope you enjoy it.